Hi, hello everyone. My name is Dr. Stelina Gowdy. I am a board certified family physician and I practice in Athens, Georgia. Go Dogs at Gowdy Family Care Center. I am the CEO and founder of Gowdy Family Care. And what I'd like to do today is to talk to you all about hypertension, also known as high blood pressure. So, first, let's talk about what is high blood pressure. So, high blood pressure is essentially the force against an artery. So, let's say this is the artery, and the difference between an artery and a vein is that the artery carries the oxygen and the vein does not carry oxygen, essentially. So, let's say this is your artery. All right, this is our artery. And the force that is pressing against that artery is essentially called hypertension. Or let me change that. When the force is high, would be considered hypertension. So now let's talk about what numbers are we looking for when we're checking your blood pressure. For the purpose of this video, normal blood pressure is 120 over 80. There's been some talks as to should we change that number to be a little bit lower, but for today we will consider 120 over 80 a normal blood pressure. Now, when you're checking that blood pressure, there are some very important things that need to be done. Like, let's say you're checking your blood pressure at home, or even if you're at the doctor's office. Some people actually may not be taking an accurate blood pressure, so it's really important that the blood pressure is taken accurately. So when you're taking a blood pressure, we're going to use this for example. This is a blood pressure machine that I have. Let's make sure that you guys can see it really well. And the top number right here says SIS. That stands for the systolic blood pressure. That is the number that is at the top. The second one right here is DIA. That stands for diastolic blood pressure. And that's usually the bottom number on the blood pressure. A lot of the machine has a third number, and that is called the pulse, and that's your heart rate. So top number to the blood pressure, bottom number to the blood pressure, and the last number is usually the pulse. So now I am going to demonstrate how to accurately take a blood pressure. This is a blood pressure cuff that most machines will come with. And what you need to do is, one, make sure that the size is the accurate size. If the blood pressure cuff is too small, it is going to give you a blood pressure reading that is too high. If the blood pressure cuff is too big, the number is going to be incorrectly low. So it is really, really important that whenever you're checking your blood pressure, that you're making sure that the size of the cuff is accurate. And the way that you do that is you basically look at this area right here. You can see how it has two lines and then it says OK. So what you're doing when you're placing the blood pressure cuff on, number one, you need to make sure that it's right around here where that tube is sitting. And then when you're going around, it stays in place, and then you go around your arm, and you have to make sure that the area where it ends is within that OK start and finish line. So if you can make sure that that is within that range, then it is an accurate blood pressure cuff. Now, let's say if it were to be over here, you see how it's outside of that line, then that means that blood pressure cuff is too small for you. So you have to make sure that you change the cuff so that you have an accurate reading. So let's go ahead and check the blood pressure. And again, every time you do that, you may have to reposition that tube that needs to be right in the middle of your arm right here where the artery sits. Okay. And once you've done that, a few other things are important to do. One, make sure that both of your feet are on the floor. So both of the feet need to be flat on the floor. Second thing, making sure that your back is against a chair, essentially. So in my case, making sure that my back is resting against the chair and both of my feet are on the floor. Now, I may have to go a little bit lower because my chair is a little bit high because I'm trying to be within that window here. But essentially, both of your feet are flat on the floor. And then your arm has to be rested. So just make sure that your arm is resting against something. Typically, it would be a table. Sometimes when you're doing it at a doctor's office, they may hold your arm or they may have your arm on the table as well. So now that you've done all of that, the next thing is making sure that you're not speaking while you are taking a blood pressure reading. If you are talking while you're taking a blood pressure reading, it may actually be inaccurate, so maybe a little bit high. So it is important that you basically just stay quiet during the time that you're taking the blood pressure reading. The other factor that's been mentioned that could affect the blood pressure reading also is having a full bladder. Actually, having a full bladder may cause your blood pressure to be inaccurate also. So just making sure that your bladder is not full. So next step, on my machine, you click the start and stop. And I am going to remain quiet while it's checking my blood pressure, and then we'll talk about the numbers. All right. So it's a little bit higher than usual, maybe because I'm doing this video. So you can see here that my top number is 130. My diastolic, the bottom number is 85, excuse me. I'm trying to read it backwards. And the last number, which is my heart rate, is 81. Now, let's talk about what these numbers mean. So, normal blood pressure, 120 over 80. And typically, you'd like to have it at 120 over 80 or lower. When you're actually at the 130s, that is actually a little bit higher than where you'd like for it to be. 130 or higher is actually considered an elevated blood pressure. So I would say that yes, right now my blood pressure is considered elevated. So one of those things where I'll definitely have to monitor it and recheck it just to make sure that it's not just inaccurately elevated because of the fact that I was doing this video. So it is important to monitor your blood pressure. And it would be doing it a couple times a day, doing it sometime in the morning. If you are on high blood pressure medications, make sure that you take your blood pressure after you've taken your medicine, because the goal is that the medication is controlling your blood pressure. So we want to know what your number is after the medication. But definitely we want it to be at 120 over 80 or lower. 130 essentially is considered borderline blood pressure, borderline elevated blood pressure. So when you're in the borderline range, it's time to start to make some changes in your diet. Some of those things would be increasing fruits and vegetables in your diet, trying to reduce the amount of sodium in the foods that you're eating. Now, sodium, we also can call that salt. A lot of people say, well, I'm not adding salt to my diet, or I'm not adding salt to my foods. And unfortunately, there's a lot of other places where you may get sodium, not only in the added table salt, but processed foods have a lot of sodium. If you're looking at a label, which is very important, that's what I recommend to all of my patients, make sure that you're always looking at the label. The label will have something called sodium, and on average, the foods that you're taking in should have about 400 or less if you have high blood pressure, to keep your sodium content low at the end of the day. And usually for my patients with high blood pressure, my recommendation is about 2,000 approximately of sodium in a day. So if you have a food like, for example, ramen noodles some of the ramen noodles have like 800 of sodium in that one pack. If you have 2 of those packs, you're almost already like taking the amount of sodium that you should have for the day. So really, really important that you're looking at the sodium content. And exercise, just regular walking actually really helps with maintaining and keeping your blood pressure low. So cardiovascular exercise, great to help protect the heart, but also great to keep your blood pressure low. So diet, exercise, stress, of course, there's only so much that we can do sometimes in reference to stress. Some people may have a very stressful life, but still, even if your day to day is very stressful, incorporating it's even more important in your case to incorporate things, relaxation throughout your day, and watching your diet and also exercising. Now, the second level of high blood pressure is when the top number is at 140. The 140 is called definitely hypertension, elevated blood pressure, where you should be on medications to reduce the blood pressure. And the reason why it's important to reduce the blood pressure is that high blood pressure can lead to higher risk of stroke, higher risk of heart attack. So to help reduce that risk, that's why it's really, really important to control your blood pressure. So diet, exercise, help in reducing your risk of cardiovascular events. Really, really important. It's also called the silent killer. The reason why it's called the silent killer is that a lot of people do not have any symptoms when their blood pressure is elevated. So you could be walking around with a blood pressure of 180, 190. Some people are even at 200 and have no symptoms at all. And then boom, they end up with a stroke. And that is not what I would want for any of you. So it's really, really important to monitor your blood pressure. If you're going to the doctors and they're saying it's borderline, it's time to make some changes, go ahead and start to implement those changes in your diet and your physical activity to try to bring it down. Now let's go to the other spectrum of low blood pressure. Now, low blood pressure, we would call that about 90/60 or lower than that. That would be considered a low blood pressure. Now, there are some people who that is their normal to be at 90/60. For example, an athlete who's very active, their blood pressure is going to tend to be a little bit lower than others. And that's okay as long as they don't have symptoms. But if you're someone who is taking blood pressure medications and your blood pressure is very low and you're getting dizzy or lightheaded, then that increases your risk of a fall or an injury. So definitely talk to your doctor about whether it is time to make some adjustment in your blood pressure regimen. And one thing that I realized I didn't talk about is that bottom number. So 80 to 89 is actually an okay blood pressure. That's the diastolic number. That is okay. Now 90 and higher is definitely too high. So if your bottom number on your blood pressure is too high, that is also where we do need to reduce that number. So that was my conversation to you all about high blood pressure. Definitely very important that you're monitoring your blood pressure and that you make some changes to try to reduce that risk of having a cardiovascular event, a heart attack, or a stroke. It's great to speak to you all, and definitely hope to see you at our office at Gowdy Family Care Center at 1500 Olga Board, Suite 3500. Bye, everyone.